Initially, before 25 years, the patients were treated by what is called as conservative treatment, where we did not have tangential excision as the common procedure done. And we used to keep on doing dressings of these patients, and it would take a long time for these patients to heal on their own with the risk of septicemia. But now with advances in technology and advances in medicine, now we, as I said before, use the term which is called as tangential excision, an early tangential excision. Even on the day of the patient getting burned, that means we call it a day 0 or day 1, we start these excisions. And the skin bank skin is a lifesaver now. So when we have got these major burns, we can immediately save the patient if we can try and immediately cover these wounds with allografts till the time the skin gets covered by the patient's own skin. So now there are plenty of examples all over major survival all over the world where patient has definitely come across some kind of a help from the skin bank. So all over the world, the skin donation and the skin banking has saved thousands and thousands of lives, which would have been probably lost without this. So now the major burns, even patients have been saved with 90 to 95% burns with such kind of things, only with the support of skin banks.